The restorative charting for a pediatric patient is slightly different than what you will see in the adult clinic, and I want to just review a couple key things. After you have cleaned the patient's teeth, and after you have updated radiographs on screen behind you, you want to have them up on the computer screen, then pick up your Explorer and your mirror and your air tip syringe and begin charting teeth. But make sure the teeth are clean and that you have radiographs available before you begin this process. The first thing you're going to look at is, does this tooth grid show the teeth that are actually in the patient's mouth? If you need to change the teeth, this patient is 13 years old, the chances of having all of these baby teeth are slim. So we look in the patient's mouth and we need to change the teeth. I will come to this button here, click on it, and it allows me to change the teeth. I can say permanent, and that now the canine, the first molar, and all quadrants are now permanent teeth. Maybe even I have a partially erupted 12-year molar here and here. Once I have this set the way that the patient actually looks, then I will click off of this and I can go about charting new decay or restorations. Now, if this is a patient of record, before you start charting restorations, I encourage you to click on the treatment planning tab and make sure that once you do that, that the existing restorations do not show up. Notice when I clicked here that an amalgam appeared, a stainless steel crown appeared, an amalgam appeared. These are treatments that we have done already, and there's no need to take time to chart those separately. But as I go through and I begin to do new diagnosis, then you will do this just like you do on an adult patient. If you want to narrow these choices down to things that are more relevant to children's dentistry, you can click here and click on pedodontics, and now you have a smaller list of things that are more relevant to children's dentistry. Once you have charted everything, then you can click on the treatment planning tab and make a decision on what you want to do about any new disease that you have found. I encourage you to try something. Go ahead and make decisions on what you want to do, and then when the faculty come, y'all can talk about it and decide if that's the appropriate thing to do, or maybe we need to do something different. There's nothing wrong with trying to make a decision and the faculty disagreeing with that. That's just part of learning. But this is how you would complete the restorative charting in the children's clinic.